as always, I'm Dr. Hashmi. I'm a board-certified nephrologist and obesity medicine specialist. And every week on Wednesday at 5 p.m. Pacific Central Time, we try to go over the latest studies that have come out this week so you can learn all about kidney health if you're interested, on general nutrition advice, exercise advice, and of course, the latest research that's coming out around longevity. So with that, let's dive into a couple of really interesting studies that I have for you guys today to share. So we're going to talk about three different topics today. And the first topic that we're going to talk about is the FLOW trial. There are actually updates on the FLOW trial. I want to make sure you guys understand. For those of you guys who don't know the FLOW trial, it's a landmark study looking at progression of kidney disease and the role of some new medications called GLP-1s and what does that entail. We're also going to talk about an interesting study looking at specifically creatine, nitrate, and caffeine, and can it improve not just physical performance, but can it improve mental performance? So with that, let's go ahead and dive into the research and kind of get started over there. I know there were some issues around audio last week, so if for some reason the audio is bad, give me a heads up in the chat so I can make sure that you guys are able to see this and we can fix the audio right away. But I'll make sure I speak right next to the microphone for you guys. So let's start with the first study. The first study is going to be the FLOW trial. For those of you guys who haven't heard of the FLOW trial, this started back in 2019. It involved 28 countries. There were over 400 plus sites. And what they were specifically looking at was they were comparing semaglutide. Remember, that's a GLP-1 agonist. It goes by the brand names of Ozempic. It has other names as well, such as Wegovy, but the dosage was 1 milligram. Remember, that's the dosage that's used for diabetes, not the higher dosage, such as the 2 milligrams or 2.4 milligrams that's being used for weight loss. So they used 1 milligram of semaglutide, and some people call it semaglutide, it doesn't matter, and they compared that to placebo. Now, the importance of this was patients who had type 2 diabetes already. So if they were going to be included in this trial, of course, they needed to have chronic kidney disease, and most importantly, they needed to be on a stable dose of what we call renin-angiotensin system inhibitors. What are renin-angiotensin system inhibitors? Those are medications like the prills, lisinopril, enalapril, or the ARTANs, telmisartan, losartan. And they followed these patients on average for about 3.4 years to be exact. Now, the endpoints were they wanted to see, did the patients have a 50% or greater reduction in their kidney function compared to where they started? Were they getting to a point where they were in dialysis territory? In other words, a GFR less than 15, of course. Did they start dialysis? Did they, God forbid, die from kidney disease or any kind of heart disease? And the secondary endpoints were things like any adverse heart events. For example, non-fatal. In other words, they didn't die from it, but they had a heart attack or they had a stroke. And those were the secondary endpoints. So the first part is, what did they find overall? Overall, what they found was that there was a 24% reduction, which is a very large amount. 24% reduction in kidney disease decline. So in other words, people who got the semaglutide 1 milligram, they actually had a much greater reduction in developing chronic kidney disease, worsening of chronic kidney disease. And even when we look at the slope, how fast the kidneys are going down, it slowed it down. The other two findings that are important is the risk of major cardiovascular events, heart attack, stroke, was 18% lower in the semaglutide or the GLP-1 group. And third most important finding was that the risk of death from all causes was 20% lower in the semaglutide group compared to the placebo. So bottom line so far is that just looking at a GLP-1 for kidney disease, it looks like in diabetics, it may actually be beneficial. But if you guys have been listening to this channel for a while, you may know that there's another question that comes up. And the question is, we've talked about this other class of drugs called SGLT2 inhibitor, or sodium glucose transport inhibitors. And those are names such as flozins, empagliflozin, etc. So when we talk about this, the question is SGLT2s good? Adding on Ozempic even better? Or are they so similar that you can do one or the other? So let's talk about this. So there was an American Diabetes Association scientific session, and this was published also in Nature Medicine. So you'll see the references at the end of this. But what they found was very interesting. They looked at the subset of patients who were on SGLT2, and it turns out only about 15% of the people who were already in the trial were actually currently on SGLT2. So remember, this is important because it's not a lot of people. It's only 15%. So for that 15%, what they were looking for was the same thing: kidney failure, 50% reduction in kidney function, of course, any kind of cardiovascular death. So what they found was that initially, patients who were taking SGLT2s at baseline, there wasn't a big difference between them and the semaglutide or semaglutide group as far as any of the primary endpoints of kidney function decline. But at 2 years, what they saw was that semaglutide with SGLT2s decreased the rate at which kidneys got worse, more so than you did with just placebo. So one more time, when you were looking at SGLT2, names like Jardians, etc., those reduced the rate more than just using SGLT2s together. Okay, so then the question comes up, well, that's fine and all, but what does this mean for me right now if I have kidney disease and I'm a diabetic? Couple of things. First, SGLT2s, names like Jardians or empagliflozin or any of the other flozins, are a very important treatment option for you to talk to your kidney doctor about. In terms of adding on GLP-1s, that is an option. And what you want to remember is it doesn't have to be semaglutide or Ozempic. It can be other GLP-1s like, for example, Victoza, which if you haven't heard, Victoza is liraglutide and is the first GLP-1 that has just gone generic. So there is a possibility to be able to get it finally at a somewhat affordable price than what we've been dealing with all along. So it doesn't have to be semaglutide. It's more of my take is that it's more likely to be a class effect. So in other words, being on a GLP-1 with SGLT2 in patients who have significant diabetic kidney disease may be a very good option. So that's the latest on the FLOW trial. We had already covered the basics of it. Now we went into details to cover the latest and greatest. So you guys have all of the data around what's happening with the FLOW trial overall. Okay, so that being said, let's go into the questions and answer some questions because I think, let's see, D. Dutton had a question last time, which was Pirfenidone is frequently used to minimize pulmonary fibrosis and inflammation. It's used in chronic kidney disease. Is Pirfenidone used in CKD to reduce the progression of fibrosis and inflammation? The problem is we don't have any clinical studies to say that. Theoretically, yes, because we know that with inflammation, there's fibrosis and scarring that hurts in the kidney. So theoretically, yes. Do we have data to be able to show it? No. But I do think that if you're thinking about these options, don't forget the basics. The basics are, is your blood pressure good? Is your diet good? Meaning, What's your blood sugars like? So blood pressure, diabetes, weight are the three most important things that contribute to inflammation and scarring of the kidney. So if you want to improve that, you got to improve those three. Okay, going to the next question. Tyler said, Dr. Hashmi, I hope all is well. I'm on blood pressure meds, usually in 110s over 60s in the morning, 120s over 60s in midday. What is ideal blood pressure midday? Should I increase? No, I don't think you should increase. You have an excellent blood pressure. Once again, it's about progress over perfection and not trying to aim for one specific number. So as far as your number goes, the number is great. You're doing a very good job. Just incorporate the lifestyle part in there so you'll do good. Indeed, Dutton, thanks for letting me know about the audio being okay. Kenneth said, I've taken prednisone and it tastes terrible. You think they would do something, maybe a capsule. Yeah, there's nothing good about prednisone. It's a necessary evil in some cases. Speaking of necessary evil, let's go into the next study, which will kind of hit on this prednisone issue. And one last comment, Kenneth said, hope all is well with you and your family, Dr. Sean. Kenneth, all is good. If any of you guys notice, I have a black eye. And if you're wondering why, I started jujitsu again. And, I'm 49 now, and I end up sparring these 18 or 19-year-old kids who just absolutely destroy me. But I see my kids doing it, and I know that this is a way for me to bond with them. So, for the sake of being a good father, I go to class and I have, all sorts of people put me in joint logs, choke me out, and all that stuff. No shame in always going and trying. It's only when you decide to say, you don't want to do something that's where the issue lies. Okay, so the next study is about what happens when you gain weight after getting a kidney transplant. So what's interesting about the data, and I personally wasn't aware of this, but the data that this particular study documented was that about 1/3 of transplant recipients, they gain at least 10% of their body weight within 1 year of receiving a kidney. Once again, roughly 1/3 of transplant patients are gaining 10% or more weight within 1 year. Why does this matter so much? Because what we know is that the weight gain will lead to all sorts of issues. It creates oxidative stress. It creates mechanical stress. It can lead to high blood pressure. And of course, it can lead to diabetes. So put all of those things together, and what you'll end up finding is that the same things that caused your kidneys to die in the first place are now coming back and making the transplanted kidney die sooner. So in this particular study, the researchers were looking at 1,500 adults who had a transplant in basically 2000 to 2023 at NYU Transplant. So they looked at all of that data and they looked at what was the post-transplant, after transplant body mass index, in other words, weight and height combined, and what happened to their kidney function. So what they ended up finding was that if they looked at people, they showed that if you had a body mass index of less than 30, your kidney function was declining around 2.3 or so mils per minute. But here's where it becomes really scary. If you had essentially what we call class 1 obesity, which is a BMI of 30 to 35, your kidney function declined 1.5 times faster than if your BMI was less than 30. Once again, if your BMI or your weight, so we classify it as body mass index, if your BMI was greater than 30, your GFR declined 1.5 times faster than if you were less. Now, if you were class 2, which is a BMI greater than 35, in that case, your GFR was declining 4.5 times faster than if your BMI was less than 30. So if you're looking at this and you're asking yourself the question of, what does this mean for my overall health? What can I do that now that I've gotten a kidney transplant is please work on your weight. There was a comment about prednisone, and people gain weight on prednisone. But keep in mind, prednisone will keep your appetite up. But if you don't have easy access to junk food, you will find that it's much harder to gain weight. The reason we talk about things like a plant predominant diet, meaning adding more plants, right? Whole grains, lentils, beans, nuts, seeds, fruits, and vegetables. The reason we talk about that is number one, they're not calorie dense. You can have so many of them, and you can learn to eat so much more and not gain weight. Now, if you eat junk food that's quote unquote plant based, you'll gain all the weight. So unhealthy plant predominant diets are very bad for you. Healthy plant predominant diets are very good. And so many videos I've done talking about that difference. But you want to understand that weight is an absolute killer. And it's not just for the kidneys, it's for every single one of your organs. And so even though I know BMI is a terrible marker, it's not accurate, there are so many things, doesn't account for muscle, so forth and so on. That being the case, you can still rely on the BMI to give you some idea. Okay, let's go into the final study, but before we do, let's answer a couple of questions. Simple Green Vitality said, thank you, doctor, for everything you do. I've learned a lot. Thank you so much for joining and for your support and the kind words. That also means a lot to myself. Let's see, other stuff. Deborah said, started Forxiga, which is a SGLT2, 10 milligrams, and GFR went down 29 to 26. So remember, anytime you start an SGLT2, Deborah, anytime you do that, your kidney function will decline a little bit. It's based on the mechanism of how the drug works, just like you do with RAS inhibitors, lisinopril, sartans, all those guys. So keep that in mind that yes, that will happen. So please be mindful of that. Let's see. Rockin' Robbins Nest said, why no closed captions? I don't know how to turn them on while I'm talking. I certainly turn them on after, so I apologize for that. And let's see. Tyler said, are ACE and ARBs still the best first line CKD treatment? The answer is yes, because you're targeting blood pressure and the mechanism is kidney protective. And on top of that, we end up using SGLT2s. So remember, the data we have that's very strong is SGLT2s and of course ACEs and ARBs. The GLP-1 is just starting to come out. That's the FLOW trial that just came out. All right, let's go to the last study. The last study is very interesting. It's looking at creatine nitrate and caffeine. And for those of you guys who know, I have this migraine / seizures, and I take creatine monohydrate, and I don't take it because I'm trying to get muscles. I actually take it because the data when it comes to brain health is so cool and interesting, and that's why I've been taking it. So what's the data? What's this latest study about? So when we look at creatine, and the most common form of creatine is creatine monohydrate. Remember, the idea there is it will replenish your adenosine triphosphate or ATP. Why do you care if your ATP is good? Because if you're doing short bursts of any kind of intense exercise, having creatine makes a difference. So many studies, over 1,000 studies on this topic. Now, creatine nitrate is a little bit newer, and the thought process there is that the nitrate portion may act as a vasodilator to also increase nitric oxide production, which in turn, by dilating your blood vessels, improve blood flow, provide more oxygen. So that's the theory behind creatine nitrate. But once again, the type of creatine that has been the most studied is creatine monohydrate. Okay, so caffeine, on the other hand, we know that caffeine is used for a lot of people. I drink a lot of coffee, and I did a video on coffee and kidney disease, and somebody wrote in there that I was being paid by the coffee producers. I wish, and if there's any coffee people out there who want to pay me, by all means do it. I'll gladly take it. But what's interesting is caffeine, as we know, it's used to reduce fatigue and alertness in terms of enhancing alertness, but like all things in life, if you do too much, it has terrible consequences. So that's why there's a sweet spot to coffee. And remember, sweet spot means 2 to 3 cups a day. Like a tall coffee at Starbucks, that's actually 2 cups right there. So it's 2 to 3 cups. All right. So there was a study that took place at Human Performance Lab in Jacksonville State University. And what they did was they recruited men who basically were used to doing resistance training, and they'd been at least doing it for 2 years. So all of these were not beginners when it comes to strength training. Now, the big thing was all of these guys had to do their same habits. They weren't to try any new exercises or anything. And the final sample size of the study was only 12 men, 18 to 40 years old. None of them had any diabetes, cardiovascular diseases, high blood pressure, and their BMIs were all in the healthy range, 18 and a half to 25. Now, they gave them 5 grams of creatine nitrate or 400 milligrams of caffeine or a combination of both, or the fourth arm was placebo. And this was done for 7 days in a row. So 7 days of either creatine, 7 days of caffeine, 7 days of creatine plus caffeine, or a placebo, which in this case was maltodextrin. And they gave all of these 4 options to each of the individuals at least 45 minutes before they had them do the exercise test and the cognitive tests. So what they did was they had them do things like bench presses, leg presses, and they were looking at how much can they lift and how many reps can they knock out before they fail. In addition to that, they also did cognitive function using standardized tests. This is the Stroop word color test, which essentially measures how well you can pay attention, how fast your processing speed is, how well you're able to think through things. So, what did they find? Well, a couple of things. First was that surprisingly, creatine nitrate did not improve as far as any exercise capacity. They didn't lift more, they didn't have better reps, none of that stuff. So, this is surprising because creatine monohydrate does that. On the other hand, though, what they found was that creatine nitrate with caffeine significantly improved how well people performed on brain function tests. So, once again, it was really interesting that taking caffeine and creatine together found that brain function was better. As you've seen some of the other episodes that we've had, we presented some other studies that talked about how just taking creatine can enhance cognitive function over the long run. And those guys use creatine monohydrate. Now, before everybody jumps on creatine nitrate, remember, this is only 12 people, right? It's only men only. They're all healthy. It's 7 days only, so it's hard to tell. In terms of creatine, the most studied is creatine monohydrate, and it's not creatine nitrate. But it's really interesting to see as data continues to come out and continues to show that you can actually do better in terms of brain. So once again, the reason that I take creatine is not because of any vanity reasons. It's specifically because of the data in terms of brain health, and that's very fascinating. All right, going to Instagram really quickly. Let's see, Marielle, I hope I'm saying that correctly. I'm on prednisone. I have so many side effects, but it's helping with my protein leakage. So, Mary, just keep in mind that outside of prednisone, there are so many other options that we have available now. So, if you're having so many side effects, talk to your kidney doctor. Your nephrologist can come up with all sorts of steroid sparing regimens to try out. And it's not a bad idea to look into it if you're having side effects. There are people who take steroids and nothing happens, and that's fine. We're able to get away with it. But others who are, we end up wanting to change. Let's see. Simple Green Vitality said, my husband was diagnosed with FSGS 2022, and the albumin creatinine ratio was, let's see, 74,187. Wow. And now it's 1,000. That is an incredible recovery. Congratulations as far as that goes. Okay, let's go over here, answer some more questions. And Crafty S said, blessings, Dr. Sean, to you and your family for all you do. Hugs, hugs. Thank you so much. I really appreciate it. And, one of these days, it's been so crazy week. Everybody keeps asking me why. If you can't see it, it's a really crazy black eye. But, why you have a black eye? I'm like, listen, I just, there's no crazy story. I wish I had an exciting story to tell you guys. I don't. Let's see. Uh, Rock and Robin, as Nat said, just don't eat foods that cause inflammation, avoid sugar. Whenever we get rid of refined sugar, and don't forget, we have talked about many times how alternative sweeteners, the Splendas, stevias, monk fruit, erythritol, xylitol, NutraSweet, aspartame, all of those guys are also really bad for you. So that's why it matters. And Tyler said, I bet the other guy looks worse. Tyler, I wish I could have said that, but no, sorry. The other guy looks great. I'm the one who's trying. But this means I'm yes to Rock and Robin's Nest said, black eyes, huh? You in the club? I am definitely in the club, and it's not the Fight Club. D. Dutton said, what causes more damage, 10 millimeters of systolic or diastolic? So remember, this is a tricky question to answer simply because they both do. That's a cop-out answer. But it's hard for me to tell you which one would do more because of the fact that diastolic is more about the stiffness that's already existing. Systolic is the pressure that every time your heart beats is the pressure that shoots out. So diastolic is a sign of stiffness that's already occurring. Systolic is too much pressure going forward. Both, humbly, are bad. The problem with most people is they ignore their diastolic. So they might have a blood pressure of 125, 130 over 90, 95. The 90, 95 is important to make sure you fix as well. And Crafty has said, I walked into the door getting up early hours to the bathroom and got a black eye. Awesome. Awesome. So, now I feel better about my black eye. That's awesome. Let's see. When people have weight loss surgery, their diabetes disappears. Big money, dialysis, yep, the cures are being hidden. So remember, weight loss becomes such a big deal because at the end of the day, weight is absolute. What does that mean? If you have muscle or if you have fat, the overall pressure on your kidneys is overall pressure. This is why a 250-pound bodybuilder who comes and sees me, I still tell them to reduce their weight because you want to lower the pressure on the kidneys, have the kidneys work less. And that's why it matters so much. Let's see. Ibonique said, don't eat man-made ingredients and you'll be okay. So Google side effects of everything you put in your mouth, all ingredients, even the ingredients in water. So, this is where, once again, progress over perfection. Every day we can make our good a little bit better. The day we become best is the day that we are already dead. So never think about becoming best, but just focus on good. Good to a little tiny bit better, and that's the only thing that matters. Let's see, Tarun said, my mom is on dialysis, ESRD, and has been getting dialysis for the last 2 months. We're working on transitioning to PD. Her pleural effusion is high. Is that because of kidney disease? Yeah, so what happens is if people are either drinking too much water or their heart isn't working strong enough to pump the blood forward, fluid can start to back up. And as it does, it can back up into the lungs. So when you go on dialysis, you'll see that we make such a big deal about your dry weight. One of the common mistakes that people do is they will look at their legs and say, look, my legs, there's no swelling in my legs. Therefore, I must be okay. The answer is no. We know that you may look okay, but still have a ton of extra fluid inside your body. So don't forget that as far as that goes. Let's see, Tyler said, does high sensitivity HSCRP inflammation markers also pertain to kidney inflammation? And if the CRP comes in really low, is kidney inflammation low? The answer is don't know, because what you're doing with CRP is you're measuring what's in the blood. You're not necessarily finding out what's inside the kidney. This is why even if your CRP is low, you still want to work on those things such as blood pressure, weight, and sugars. as the key ingredients. Don't forget to sleep. If you're not sleeping, you're absolutely creating a really bad environment. As I get older, one thing I can tell you is I'm making sleep a priority and I'm cutting down my work just because of it. One, for health reasons, because of my migraine slash seizures, but two, also because you want to prioritize sleep. All right, with that, I know the time is 5:31. Once again, I want to thank you guys very, very much. You guys are so gracious with spending your Wednesday afternoons for 30 minutes with me. There are lots of people out there who do this way better than I do, and I know you could be joining them. But thank you for your faith. I hope that you find these things helpful. Just keep in mind that this information I present, I have absolutely nothing to gain. You guys know my story. It's right there on YouTube if you haven't seen it. Just keep in mind, I have two daughters of my own. At the end of your life, just the most important part you got to remember is doesn't matter how many medals you got or accolades you got, nobody cares about any of that. It doesn't matter so much the journey, it matters the company you surround yourself with. So if you can, spread kindness, be kind, do something great for somebody, and I promise you that fulfillment that you get in yourself will help you to make this journey that we call life just a little tiny bit better. Be kind, do kind, live kind. And with that, thank you for your support. I will see everybody next Wednesday at 5 p.m. Pacific Central Time.